Now the topic is inpatient pharmacy services. The duration of attachment of PRP is 16 weeks. Then first of all, management of inpatient pharmacy or satellite pharmacy. It contains knowledge of stock movement and control, peak hour management, staff mobilization, staff training, handling drug information requests, and pharmacy QAP. Inpatient dispensing include accuracy in prescription ordering and supply system, bulk indent order and verification, good communication skills and knowledge, documentation of relevant data and statistics, and perfection in reading, interpreting, and dispensing medication profile, indent books or ward requests, perfection in screening of inpatient order or medication profile, for example, dosage, polypharmacy, drug interaction, adequacy of instructions, contraindication, incompatibilities to ensure appropriateness of therapy. Knowledge of computerized manual recording and labeling method. Then drug range and knowledge on generic names, proprietary names, pharmacological grouping, hospital formularies. Ability to contact prescriber to discuss error or prescription mistakes. Perfection in reviewing medication profiles, perfection in filling prescription, and also perfection in counter checking. So that inpatient dispensing included the perfection in prescription ordering and supply system, also good communication skill, knowledge, documentation of relevant data, and also perfect in reading, interpreting, dispensing, and screening of inpatient orders. So that now the dangerous and psychotropic drug management. A PRP must have the knowledge of psychotropic and dangerous drug distribution and disposal in accordance to respective legislation. Dangerous Drug Act 1952, Poison Act 1952, Poison Psychotropic Substances Regulation 1989. Inpatient pharmacy services included patient medication counseling, which included ability to advise on indication, storage condition, precautions, side effect, food-drug interaction, dosage, compliance and missed doses, use of devices, for example, inhaler, insulin pens, and interferon pens, etc. Discharge, dispensing, and counseling. It also includes ward inspection, which contain stock handling, identify storage requirement, and record. Now the section 1 contains processing of prescription or reviewing medication and minimum 30 medication profile per day the PRP must check. Week 1 included the chart which mentioned date, number of profile reviewed, number of interventions, types of interventions, number of communication with doctors, comments and signature of preceptor or chief pharmacist. There are codes mentioned for intervention: incomplete prescription, polypharmacy, wrong dosage form or dose, drug interaction, contraindications, counter signatures. This is the same for the week 2 and also for week 16. Now move towards the number of prescriptions wrongly filled. For that purpose, another chart maintained which include date, number of prescriptions or indents, number of prescription wrongly filled, description of error and signature of preceptor. Minimum 30 prescription line item or indent per day must be checked by the PRP. This is same for week 2 and also for week 16. Now move towards the patient counseling, and its attachment also consists of 16 weeks. Week 1 reporting also indicated by the chart which mentioned the date, patient RN, and counseling based on the type of pharmacotherapy management. Minimum 5 patients or types were applicable. So that it included the anti-diabetes, anti-hypertensive, anti-asthmatic, and anticoagulants and other which specified by the PRP. Name and signature of preceptor. Then this lead to week 2, 3 and then week 16. This is same for week 2 and at least minimum 5 bed patients counseling and maximum 20 patient counseling included in that. And also for week 16. So that the same pattern followed by week 1, 2, 3 and leads to week 16 as we see previous inspections. In the same manner the board inspections has been done. Now the psychotropic and dangerous drug monitoring. This can be controlled and monitored by a chart which contain date and number of prescription dispensed and recorded. Minimum 10 prescriptions per week which in which the psychotropic and dangerous drugs may be prescribed. Name and signature of pharmacist in charge. This activity leads to week 1, 2, 3 and towards week 16. And also for week 16. This section includes preparation, observation, counter-checking of job sheet of extemporaneous which includes minimum 5. And the PRP must have ability to understand formulation and calculate the appropriate quantities required. Then the preparations mentions by the chart the date, patient MRN, name of prescription, remarks and signature of preceptor. This also lead to week 1, 2, 3 and towards week 16. Then we come towards the assessment. Then the assessment included the management of inpatient pharmacy and which have different tasks about the knowledge of the following: checking of stock, slow moving item or near expiry item, indenting of stocks and procedure, staff management and training, documentation of data and statistics, familiarity with drug range and generic names, and pharmacological grouping, hospital formularies, comprise or manual record and labeling method, psychotropics and dangerous drug distribution and disposal in accordance with the respective legislation. Then the chief pharmacist checks the level of performance of a PRP and his comments and name and signature of preceptor or a chief pharmacist. Then the competent assessment. The tasks are processing of prescription or reviewing medication profile, counter-checking of prescription or indent orders, patient medication counseling, ward inspections, dangerous drug and psychotropic, management of inpatient pharmacy, in which also level of performance indicated and comments by the preceptor. Now the journal comment on attitude, same formula is here, and after that preceptor name and signature. Note that if the service is not available in the hospital, the principal preceptor or head of pharmacist in the hospital has the right to evaluate the PRP performance. And also the person marks should not less than 60% for every unit or services. And this is all for inpatient pharmacy.